Younger, I would say younger, and certainly not complicated by other problems. Many people with MS have other symptoms such as pain, spasticity, urinary dysfunction where they have frequent UTIs, urinary tract infections. A patient with just the MS would probably be the best responder to ocrelizumab. But if a person with MS has got neuropathic pain, or the person with MS has severe spasticity, or has frequent bladder or bowel problems, or emotional problems, depression, that person will not be as good a responder unless those symptoms were managed first and then you get them on the drug. So it's a whole package. MS, that's why the team approach is so very important. You just don't go for the infusion. You got to ask, how you doing? There was a mayor, Ed Koch, many years ago. He would ask that question. I think that's an important question we need to keep asking the patient. How are you doing? How are you feeling? Is there anything else bothering you? And sometimes symptomatic management should come first. Now that's right. That is right, because the older population has high risk of comorbidities such as hypertension, such as obesity, people that become sedentary. Years ago when I first started working in MS, people with MS were told to rest a lot. Don't strain yourself, don't overheat yourself. It's a true story. Today we know that's not a good idea, but the older generation that have had MS for 20 or 30 years may be obese, they may be smoking. We now know smoking is not good for MS. They also don't take good care of their just general health. They don't eat well, or they may go off on some weird diet that would cause them to have some nutritional insufficiency. Women with MS particularly, and men also, could develop things like osteoporosis because of poor diet, lack of exercise, lack of activity, smoking, again, hormonal changes. So as the person ages, the problems of aging might interfere with the response to a drug like ocrelizumab, which is such a terrific drug, but these other comorbidities might interfere with that response.